Health Minister Nicola Roxon today released a 4-year timeline for the introduction of the government's national reform program, including local area networks to coordinate hospital and GP services. In the meantime, to help ease the shortage of doctors in rural and regional areas, the federal government has been offering relocation payments of up to $120,000 and other incentives to encourage doctors to leave the cities. Despite this, hospitals are still being forced in the bush to employ locum doctors to fill the gaps, paying them up to 3 times the salary of a regular doctor. The shortage is so acute that locum doctors from New Zealand are being flown across the Tasman to work in hospital emergency rooms, at times just for a weekend's work. Bronwyn Herbert reports.
We're using locums for things that they were never designed to be used for. They should be short-term release for doctors who go on leave.
Locum doctors have long filled gaps in short-staffed hospitals, but medical recruiters are now going to new lengths to find doctors.
The weekend warrior phenomenon for doctors is where you get a doctor who does have a permanent job in New Zealand and just wants to head over to Australia and earn massive dollars very quickly and then come back to their standard job.
New Zealand doctors are flying here for short-term locum work and earn up to $7,000 for a weekend's work. One of those cashing in is Kiwi Jason Pascoe. He's moved from Invercargill on New Zealand's South Island to take on a 3-month locum job on the New South Wales North Coast.
Number one for a lot of people is the pay. You are paid more, and I guess part of the reason for that is you don't have the job security. It's a short-term stint, often there last minute, and so you are compensated for that.
Port Macquarie, like most regional hospitals across the country, can't get enough doctors. Here, the emergency room is manned almost 24/7 by Kiwi locums.
It's actually quite a popular thing for New Zealanders to come over and do either short stints. So I wanted to do some more emergency department type work, and although that is available in New Zealand, it's I guess Australia being a lot bigger and having more hospitals, there's more of it available.
In Victoria, Queensland and Western Australia, health authorities say it's too difficult to quantify the cost of supplying locum doctors. In South Australia, $5 million was spent on locums working outside metropolitan areas, a 10% rise in spending in the last year. In New South Wales, the government spent $59 million in the last financial year for locum doctors outside cities. That's more than $1 million a week.
We're just running over attenuation right now.
The Dean of Medicine at James Cook University in Townsville, Richard Murray, has been studying the workforce needs of regional hospitals for the past 15 years.
We are short of doctors. We've got an ageing population, but that's certainly not the only thing.
The federal government has recently ramped up its funding for rural doctors, announcing $134 million in incentives to keep doctors in rural areas, which includes payments of up to $120,000 for doctors to leave the city. And from the 1st of July, more than 3,000 overseas trained doctors will have their restrictions on where they can practice reduced if they work in rural and remote communities.
You might want to do standard policing.
A recent surge in doctor training has buoyed health authorities that Australia will eventually grow its own workforce.
We've gone from a low of around about 1,200 odd domestic medical graduates a year, with relatively small international students who come in and train to get a medical degree in Australia, to something like 3,000, will be just over 3,000 domestic graduates in less than the space of 10 years. And that is an astonishing level of growth.
General appeals end the battleground.
But Professor Murray says the right incentives still aren't in place to attract and retain doctors to where they're needed most.
You know, if we just shoehorn all of those graduates into highly specialised, junior doctor training posts, etc., in fact, this could be a net negative. And they won't trickle out And I guess once you build that training capacity into major metropolitan hospitals, it's hard to then extract that at some later point and send it to the bush. You know, you really do need to take the opportunity now to build those pathways into regional Australia.
The head of the Rural Doctors Association, Steve Sant, says equal pay still doesn't exist.
There are some federal government incentive schemes, but they're very small and they really don't offset the difference between what, say, a GP who does emergency on-call work in a rural hospital compared to a specialist emergency physician in a major metropolitan hospital. The same patients are turning up, the same treatment's being given, but one's being paid an awful lot less than the other one, and they're having to work a lot longer hours.
In the meantime, it'll be imports like Jason Pascoe who'll help fill the gap.
Most hospitals, when they've got locums, you know, they would rather they be full-time permanent staff, and that's I can certainly understand that. Not just because locums are more costly, but just the fact that it's the guarantee of somebody there for the long term, and it just works better for them, and that's fine. I mean, I certainly understand that, but I mean, I'm here for however long they need me.
Bronwyn Herbert with that report.